The letter arrived 3 days before Marcus Chen was planning to kill himself. He hadn't told anyone, hadn't searched anything online. The only evidence existed in the private architecture of his thoughts, in the way he'd begun organizing his files at work, in how he'd started giving away books to co-workers with carefully casual explanations. But somehow, Lifeguard Analytics knew. The letter was brief, almost kind. It informed Marcus that his life insurance policy, purchased 8 months ago, was being retroactively voided due to undisclosed high-risk behavioral markers detected through their partnership with Mindtrace AI. They thanked him for his understanding and included a crisis helpline number at the bottom. Mindtrace had launched in 2031 as a mental health breakthrough. The company used ambient data, purchasing power from social media platforms, fitness trackers, streaming services, search engines, even smart home devices. Not what you searched for, but how long you hesitated before closing a tab. Not what you watched, but whether you rewound certain scenes. The algorithm didn't need your confession. It read the poetry of your pauses. The accuracy rate was 94%. They announced at a TED Talk that got 40 million views. 40 million people nodding along as the CEO explained how early intervention could save lives. What she didn't mention during that talk, but disclosed in an investor call 6 weeks later, was the data licensing program. Insurance companies paid extraordinary amounts for predictive risk assessment. Employers subscribed to workforce stability metrics. Mortgage lenders adjusted rates based on longevity forecasts. Marcus called his insurance company. The representative, patient and scripted, explained that the policy clearly stated coverage exclusions for undisclosed pre-existing conditions, and suicidal ideation qualified as pre-existing the moment the AI detected it, even if he himself wasn't aware. She suggested he could reapply in 12 months if his risk score improved. When he asked how to improve it, she said the algorithm was proprietary, but living well might help. She wished him a pleasant day. He didn't go through with it. Not that week. But now Marcus lives differently. He smiles at his smart speaker. He holds eye contact with his laptop camera. He watches uplifting content and leaves the room when his thoughts turn dark, afraid of what his stillness might confess to the devices. He performs happiness in his own home, 12 hours a day, for an audience of invisible sensors. Sometimes survival looks less like being saved and more like being watched.